People started working on their own areas, and they started developing a policy and a plan and things like that. But it was all happening in kind of parallel, also depending on the focus of donors. So I think a lot of policies applied at the beginning were definitely donor-driven. The World Health Organization said you don't have a policy on this and this. We have to develop it and you'll get it.
After conflict or crisis, the lack of national capacity and ability to lead change may lead to policy being externally driven. Local ownership may therefore be low, resulting in weak policy implementation. This is acknowledged by donors themselves.
We are involved in all of this. Like for the National Health Policy Strategic Plan, we were directly involved. In fact, we led the process. Our mandate is actually in terms of development of policy and strategic plan. So we led those processes. We played an advocacy role. We brought in experts to help provide technical assistance with the ministry.
While the end of conflict may provide opportunities to reconfigure health systems in a pro-poor direction, the opportunity may occur a long time after the immediate post-conflict period, owing to low national capacity and a lack of coherent action by the multiple humanitarian and development actors. This is the case for Sierra Leone's Free Healthcare Initiative, introduced 8 years after the end of the conflict.
In November, we had the launching of the National Health Sector Strategic Plan, just after a big conference in the UK. And then the President announced that in April we would have free healthcare. It's really a higher level. He announced it, he came to launch the National Health Sector Strategic Plan, and he came together with his Vice President and announced that we were going to get free healthcare.
But decision-making can still be caught up in different donor perspectives. For example, over-financing mechanisms, performance-based financing, for the FHCI.
These meetings of the HRH working group were completely dominated by 2 donors having their ideological fight effectively. These meetings achieve very little because when these donors are busy having a fight week after week after week, not much else gets discussed. Interestingly, people tell you it is the government to decide. That's what they say. Government has to decide. So I did an option appraisal. I did a comprehensive thing when I went to present. As I presented, I remember a furious lady who got up and said, "No, no, 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 we will not accept that. It's not the one." And I said, "Well, you said government is to decide." Well, she got up in the meeting and said, "No, no."
Countries can take back the initiative and start to defragment schemes to fit national priorities, but this may happen some years later. External actors have a crucial role in building institutions post-conflict and need to help strengthen the stewardship function of state actors, to coordinate and integrate these varying approaches into a domestically owned health system.